can talk to you now a little bit about how dynamic interpersonal therapy works in action. DIT has three main aims. The first one is to help our clients make the connection between early repetitive patterns of relating, which are associated with relational problems, relational conflicts, and depression. And they originate in childhood. And by exploring the mental representations which are associated with those repetitive relational patterns and difficult conflictual relationships, we try to help our clients revise those outdated patterns of relating and update the way they see themselves and others. Another very important aspect of the work that we do, which is associated with that process of updating internal representations of self and others, which originate in childhood, is the process of enhancing reflective functioning and mentalization capacity. Mentalization capacity refers to our ability to infer other people's mental states in terms of feelings, thoughts, or intentions, as well as to be able to make sense of our own internal states. Depression, unfortunately, narrows mentalization capacity sometimes, and we tend to experience others as partial figures or objects, just to use a psychodynamic term. In therapy, we try to help our clients expand and strengthen their mentalization capacity. So rather than seeing others as potentially rejecting or consistently critical or abandoning, which are usually associated with past experiences, we try to help our clients relate to others as complex human beings, intentional human beings, to sort of support them see other people as complex human beings and to sort of help them move away from past relational trauma or past relational wounds. Finally, another very important aspect of DIT is the strengthening of epistemic trust. Epistemic trust refers to our capacity, if you like, to rely on others as sources of information about ourselves and the world. Once again, during depressive states, when we become more withdrawn, more insular, we tend to avoid entering relationships. We tend to avoid challenges, and we also tend to disbelieve others. As a result of that withdrawal or introversion, we also deprive ourselves of the capacity to internalize positive feedback and gain more knowledge about the world from others. So restoring epistemic trust, which is also associated with specific techniques that we use in therapy, like emotional attunement, like empathy, like validation, instead of dismissiveness or criticism. People may be assisted in internalizing a new relational template that may then be applied outside the clinical room. In other words, they can start believing in others as reliable and credible sources of information about themselves and the world more broadly.